first thing I want to do is I want to look inside your throat, inside your mouth. Okay, so I'm going to use this little tongue depressor to push down your tongue, and I'm going to use this light to take a look inside your mouth. Okay, so if you could open your mouth as wide as you can for me, please. Very good. I'm just going to push down your tongue just a little bit there. Okay, and I'm just going to have a little look inside your mouth. Okay, now this might be a tiny bit uncomfortable for you. I am, of course, using a wooden stick to poke your tongue and to keep it pressed down, which is not too nice, really, is it? Not too nice. But you know, it shouldn't be painful. It shouldn't be like a terrible traumatic event. Just a tiny little bit uncomfortable, that's all. And it won't last a very long time either. I'm just having a little bit of a look in general to see the redness of your mouth, to see if I can see any swollen tonsils in the back there, to see if I can see anything that might be out of the ordinary, anything that might indicate a particular illness. But no, so far looking quite good, actually. Looking quite good indeed. All okay there. The light was quite bright, wasn't it? You feeling okay? Maybe just take a bit of a blink. Blink, 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 blink. Blink, 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 blink. Just reset those eyes a little bit, you know what I'm saying? Okay, well, I think to be certain, I do need to take a sample of your throat, a cotton swab of your throat. Okay, now this is a little bit uncomfortable. Okay, I am gonna have to do a few things that are uncomfortable today, but none of them will last too long. They'll be very, very quick. They'll be over before you know it. And it's important to do them to rule out any, major illness, which I don't think you have personally, but we need to do these tests just to make certain. Okay, so I've got my little cotton bud here, and what I'm going to do, I'm going to ask you to open your mouth again. I'm going to put the cotton bud in your mouth. I'm just going to very quickly, very gently, as gently as possible, swab the my little brand new cotton bud here. This is going to go up your nose. It's going to tickle. It is going to tickle. You got a lot of hairs up there, as I mentioned earlier. A lot of hairs. That's okay though. Now, let me just put this little cotton bud up your nostril. Okay, it should only take a couple of seconds to do. Okay, going in 3, 2, 1. There we go. Very good. Very good. Getting the sample. And done. And done. Finished. That wasn't too bad now, was it? No, wasn't too bad at all. Excellent. So we've got 2 samples. 2 samples collected. Going to be sent off to the laboratory for testing. And we'll get those results back another time, okay? So we're doing very well so far. Now then, the next thing I would like to do involves the stethoscope. Okay, my handy dandy little stethoscope. Of course, I'm going to be listening to your heartbeat, and I'm also going to be listening to your lungs. Okay, so excellent. I'm ready to begin if you are. I'm just going to place this over your clothing on your chest. Okay, there's no need to remove the clothing. Okay, put that there. I'm just listening to your heartbeat now. Okay. Very good. Very good indeed. Very strong heartbeat. Very strong heartbeat. Excellent rhythm. Perfect. 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 Okay, that's a really good sign. Okay. Now, I'm going to listen to your lungs. Okay, we're going to do this a few times in a few different locations. Let me just put my stethoscope here for a moment. And if I could ask you to take in a deep breath for me, please. And breathe out. That's great. Going to move this to another location. If you could take a deep breath in again, please. And out. That's good, that's good. One last location, okay? One last location. Deep breath in for me, please. And out. Yes, that's good, that's good. That's, I would say, 90 to 95% good there. You heard a little bit of maybe crackling, and the one side of your lung there might indicate a little bit of an infection in the lungs. That might just be a part of whatever it is that you've got. It could be a bit of the flu, a little bit of inflammation in the lungs caused by this flu that you have, okay? It's nothing concerning, certainly not bad, but I will consider it as I continue through the tests today. Okay, now, what do I want to do next? Ah, yes, I would like to look inside your ears next, okay? Now, I'm just going to grab my otoscope, so if you could stay there for just a moment, please. Just got to put it together, it won't take long at all, okay? Give me a moment. Okay, excellent, that's great. Just going to put this in your ear and I'm going to have a quick little look inside that ear of yours now, okay? Okay, that's not too bad actually, not too bad. Looking like a fairly regular ear. Got some earwax in there, of course. That's to be expected though, that's normal, that's good, even. No excessive redness, and from what I can see, no blockage either. Okay, how are you feeling? trouble in your ears then. Quite good actually. Just put that back there. Let's see, what else do I want to check with you today? Okay, what I'm going to do is I'm going to collect a sample of your earwax from each of your ears, and I'm also going to send that off to the lab to get those tested as well, just to make sure that everything is okay from your ears perspective as well. So it's going to be very similar to the previous swabs. I'm going to be using just a little cotton bud. This should feel very nice and easy for you. It's going to feel just like getting your ear cleaned. So if anything, this one should probably feel quite nice. It will also take me a tiny bit longer than the previous ones, but not too long at all. Okay, so I'm going to start by taking a sample from this ear from you. Okay, so here we go. I'm going to do that now. Okay, that's excellent. That side is done. Need to do the same at the ear now as well, okay? Okay, that's perfect. Got the double sample there. Just gonna put that away in the little bottle. That will be sent off later. Okay, excellent. We're doing very well today. You're doing very well indeed. Now, I do want to check your hearing ability. What shall I use for that? I'm just going to grab my pen. Just one moment. Okay, what I'd like you to do now is I'd like you to close your eyes for me, please. No opening them, no cheating, okay, no cheating. And what I'm going to do is I'm going to use my pen to make a couple of little clicks, like that, okay, a couple of little clicks. And I want you to tell me what side of your head the clicks are coming from, the left side or the right side, okay. Here we go. Left or right? Excellent. Left or right? Excellent. Left or right? Brilliant. Left or right? Great. Left or right? Brilliant. Left or right? Excellent. Left or right? Excellent. Left or right? Excellent. Okay, I think you don't have any problem with your hearing ability. Okay, so you can open your eyes now. Also, from what I saw inside your ears, I don't think you have a problem. We did just take a swab sample to be tested just as a safety measure, really. Okay, so let's see, what else do I want to do? I think I do want to test your ability to smell and to taste whilst we're here today. Okay, so let me just take one last quick look up your nose. Just want to confirm what I taste test now to confirm. You're doing okay? Your eyes okay? Excellent. Okay. Yes. Right. I'm going to get 3 artificial flavors, and I'm going to make you taste them, and I'm going to make you smell them. Okay. They're going to be different for both taste and smell, and we're going to see how well you perform. If you don't perform particularly well, that might indicate something specifically wrong with your smelling or your tasting. Okay, so let me grab my little artificial flavors and smells now. Okay, we'll begin with the smell test. So I'm just going to shake up my little smelly liquid here. Okay, so I'm just going to hold this underneath your nose. You're going to take a little bit of a sniff, and you're going to tell me what do you think it smells like. Okay, here we go. If you could sniff that for me, please. What do you think that smells like? Rhubarb. It smells like rhubarb. Yes, very good indeed. Okay, on to the second smell. Okay. Righto, same thing. Get ready for smelling this one. Okay, and what do you think that smells like? Custard. That one smells like custard. Excellent. Excellent job there. Now, the third and the final smell. Okay, let's give this one a go, shall we? If you could smell that one for me, please. What does this one smell like? What do you think? Despair. That one smells like despair. Yes, yes. Well done, well done. Okay, it seems your smelling ability is absolutely perfect. 100% in fact. 3 out of 3 correctly identified. Now, I do want to do a taste test with you, but before I do that, I want to quickly just revisit your mouth. I just want to quickly look in there one last time, okay, just to make sure. So if you could open your mouth for me, please. Brilliant job. Just putting down your tongue again. Okay. My apologies for repeating myself a little bit here today. I just need to make certain my observations before I send you on your way I'm saying some doctors have a tendency to do that, don't they? They get you in and out of their office in just 5 minutes. They ask you what your problems are. They Google something. They prescribe you some antibiotics and then they kick you out. And they do everything so quickly that you forget to mention some important thing. And you feel absolutely shafted, don't you? Sometimes that's my experience with doctors anyway. So I try to be nice and thorough, okay, with each person. Now, we're going to do the taste test, okay? Very similar to the smell test. 3 different tastes that I want you to identify. My little bottle here. Let me just shake this up, okay? There we go, that should be sufficient. That should be sufficient, shouldn't it? Just going to get a little bit of the liquid in the dropper. Is that in there? Okay, that's perfect, that's perfect. Now, if you could stick your tongue out for me, please. Very good, just going to put a single little droplet on there. Very good, that's all you need is the one very strong stuff, this. Now, could you tell me what do you think that tastes like, please? Mango. You think it tastes like mango? Correct, correct, mango it is. Okay, let's go for flavor number 2, shall we? Okay, if you could stick your tongue out again. Oh, wait a minute, let me get my little dropper sorted first. Takes me a little bit of time, it does. Okay, there we go, perfect. If you could stick your tongue out for me. Very good, one little droplet on there. There you go. Now, what do you think that one tastes like? Papaya. You think it tastes like papaya? Excellent job, very good indeed. Let us go for the 3rd and the final flavor. Righto, let's do this one, shall we? Right, are you ready? Very good, a little droplet on the tongue. There we go, have a little taste of that. What do you think that tastes like? Revenge. You think it tastes like revenge? Yes, indeed, a dish best served cold, as they say. Excellent job indeed. You've done so well today. You've scored 100% on both the taste and the smell test. Yes, both of them. Well done. Perfect. So, whilst you are experiencing some flu-like symptoms and congestion, and whilst I did hear a tiny little bit of crackling on the lungs when I listened earlier, I don't think you have any major problems at all. In fact, I think you're pretty healthy overall, and you're just going through a little bit of a cold or something at the moment. Okay, so I did take some samples from you. I am going to send those off to the laboratory. They're going to be tested, and I should get those results back in about a week. Okay, and I will contact you with the results. How would you like to be contacted? I can phone you, text you, email you. advice. My advice is just rest. Take a few days off work. I can give you a doctor's note. Okay, I'll do that before you leave. And yes, I think that's everything then. Do you have any questions for me today? No questions. All okay? All happy? Excellent, excellent, excellent. That's what we like to hear. That's what we like to hear. Okay. Thank you so much for coming today. And yes, I'll give you that doctor's note before you leave. But otherwise, take care. And I'll see you